Dr. Malik Kandi. Today we will talk about a rare condition called cluster headache. Cluster headache, very rare. I have seen only two patients in my whole career. One here and one in Hyderabad. I have seen very rarely this is called cluster headache. Actually, the patient who came to us was having alcohol, and while having alcohol, suddenly he developed severe pain in one side of the eye, one eye, not both eyes, only one side. Sudden shooting pain in the left eye along with this area, but it can occur on right side or left side, not on both sides. Okay, one side, and it was red. Eye became red in 15 minutes. This all happened in 15 minutes. He was having alcohol. Suddenly, this eye got red. It became red, and there is watering from the nose. There is watering from the eye, and there is swelling of the eye. Eyelids, everything swelling, and the patient was unable to bear the pain. He was very irritable. We had to catch hold of him. He was very irritable. He was unable to sit and stand. Something like if you put some mirch powder inside, some red chili powder inside, what happens? That is how he was responding. Usually cluster headaches, they come in 15 minutes. The onset is in 15 minutes, and they last up to 3 hours only up to 3 hours. But only one side. This is usually because of the trigeminal nerve, which comes from the brain and its autonomic nervous system and hippocampus. Hypothalamus, particularly the trigeminal nerve and its autonomic nervous system and the hypothalamus just in the brain. These three are the main reasons for it. The origin comes from it. But usually what I have seen, the two patients I have seen are definitely they had with alcohol only they got, but maybe there may be other triggering factors. In the book there are so many things. So the pain is severe, and one more speciality in this headache is it comes like clusters. For example, it follows timings. Today morning at 7 o'clock it came, next day also it comes at 7 o'clock. Suppose in the morning 7 o'clock and afternoon 9 o'clock it came on the first day. Second day also it will follow morning 7 o'clock, night 10 o'clock. Like that, it follows the time, strict timing, and it can last for about 3 to 4 days and suddenly disappears. And it is like, suppose 1 or 2 months in a month it will come. In 1 or 2 months in a year it will come. Suddenly 2 to 3 years it will not be there. So the particular person completely avoids alcohol during that time, and once it is not coming, he will have alcohol again. So it comes after 2 to 3 years, again it stays for 1 year, like that. So clusters, it comes like clusters. It follows timings. It comes like clusters, 1 to 2 months in a year. Again 2 years gap, again it comes like this. This is called cluster headache, but it is very severe, very severe. The patient comes running to the hospital. I mean, he will be brought in a bad shape. He is not comfortable at all. Pain is very severe. Immediately what we do in the hospital is, it's only one-sided, one completely swollen eye, red eye. There is watering from the nose, watering from the eye, complete area is swollen. So immediately what we do is, the treatment is, of course we give immediately painkillers and some sedation, etc., because he's not sitting in the bed, he's not lying down in the bed. Most important is oxygen. You must give high flow oxygen with a tight mask, and injection sumatriptan. It is also given in migraine also. Probably here we have to give little more dose. In migraine we use 6 milligrams injection subcutaneous, or we give oral 50 to 100 mg. But here you have to go for a little higher dose. Injection sumatriptan, it is the drug of choice when the attack comes. Usually it comes in 15-20 minutes. It disappears after 3 hours. But to avoid next attacks, you can give verapamil, that is isoptin, inject tablet isoptin. Verapamil is the drug. Isoptin tablets, you can put him on isoptin so that you can prevent next attacks. But it's a very rare condition. I have seen only once or twice in my life.